Many women who've had their tubes tied in the past because they thought they were finished having children later decide they would like to have another child. When women present with this scenario, I tell them there are two options for women to conceive after having had their tubes tied. The first is to have a tubal reversal surgery. The other option is to have in vitro fertilization, or IVF. Tubal reversal surgery involves either a traditional bikini cut incision using a microscope or a minimally invasive approach using small keyhole incisions. I prefer to use the minimally invasive approach, but also to use the Da Vinci robot, which affords me better range of motion and visibility. The minimally invasive approach affords the patient a shorter hospital stay and a more rapid recovery time with less pain. During this very precise surgery, the scarred portion of the tubes are removed and the healthy tubal segments are brought back together with very fine stitches. At the end of the procedure, blue dye is flushed through the fallopian tubes to verify that the tubes are indeed open. In vitro fertilization, or IVF, involves the removal of eggs from the ovaries. These eggs are then fertilized in the lab, and then the resultant embryos are placed back into the uterus through the cervix, thus bypassing the need for the fallopian tubes altogether. IVF allows women to avoid having tubal surgery and thus minimizes the chances for ectopic or tubal pregnancy, which is more common in women who have undergone tubal reconstruction. There are several factors to consider before choosing between having tubal versal surgery or IVF. I discuss each of these with my patients at the initial consultation. The four main factors that I consider are the following. First, what method was used to surgically tie the tubes? Were they cut and tied? Were they burned? Were there clips or rings applied? Each of these methods carries a different chance for success. The second thing to consider is, what is your age and ovarian reserve status? Many women who've had their tubes tied in the past do not realize that their fertility may have declined with age. For this reason, I do a thorough assessment and estimate their egg quantity and quality, so I can tell them how aggressive they need to be. The third thing I consider is, what is the status of the partner's sperm? If the semen analysis shows normal parameters and the sperm count and motility and shape appears normal, then tubal reversal is likely an option from that standpoint. If there's significant abnormalities, then IVF truly is the better option because IVF overcomes sperm issues as well. The fourth factor to consider is, how long can you afford to wait to become pregnant based on your age and your social timetable? It takes about 6 to 12 months on average for someone to conceive after a tubal reversal surgery. And I also ask my patients to wait 3 months after the procedure to allow the tubes to completely heal so there's less chance of inflammation and subsequent ectopic pregnancy. The process of IVF, in contrast, takes around 2 months. It also affords the couple the chance to create numerous embryos and then select the best to put back for pregnancy, instead of waiting for one embryo at a time to form each month that may or may not be normal.